And welcome to this briefing for the House Health Committee. I ask for your patience if we encounter any technical or streaming issues. This briefing is being streamed on the Maryland General Assembly YouTube channel. Panelists, you will have control over the transition of your slides. Before this briefing, all members of the committee were emailed a copy of each presentation. If you do not have these documents, please let the committee staff know and we'll make sure you get them. Please note that no food or drink is permitted in the gallery. Delegates may have beverages because we're trying to stay hydrated in long meetings. Please make sure to turn off your cell phones. If a member is not present in the gallery, and many of the times it's because they're attending another meeting or presenting in another committee. I'm going to ask the committee members to please adhere to our usual committee rules. One question and one answer from the panel, not an answer from each panelist, and keep your question brief. Keep in mind that this briefing is scheduled to conclude at 1 p.m. and we will have bill hearings at 1:30 p.m. Today, the House Health Committee will hear from access to over-the-counter contraception. We're going to start with Sanjay Ray, Secretary for Higher Education, and Emily Dow, Assistant Secretary for Academic Affairs, Kalia Hunt Kabir, Success Project Statewide Coordinator, and Dr. Maria Rodriguez, Director, Center for Reproductive Health Equity. So and Dr. Rodriguez is virtual, so she's here. So thank you all for being here, and I'm going to let you get started.
Thank you, and good afternoon, Chair, Madam Vice Chair, and members of the Health Committee. For the record, I'm Dr. Sanjay Rai, Secretary for Higher Education. While it may be a bit unusual to see the Secretary of Higher Education before this specific committee, but I'm truly pleased to be here. At Maryland Higher Education Commission, we recognize that student success is not just about what happens inside the classroom. It is about the health and well-being of the whole student. Under the Moore-Miller administration, we are deeply committed to removing the barriers that stand in the way of student success. The implementation of these reproductive health mandates is a vital part of that mission. I want to personally commend our campus leaders for their diligent work, and I especially want to share my gratitude for our partnership with the Maryland Commission for Women and the national technical experts who are joining us today. To provide the detailed status update on our implementation milestones and our roadmap for the future, I am pleased to turn the floor over to our Assistant Secretary of Academic Affairs, Dr. Emily Dow. Thank you.
Great. Thank you, Secretary Rai, and good afternoon, Vice Chair and committee members. Again, I am Emily Dow. I'm the Assistant Secretary for Academic Affairs at the Maryland Higher Education Commission. Our work at MHEC over the past year has been focused on turning the vision of the 2023 and 2024 reproductive health legislation into a very lived reality for our Maryland students. We began 2025 by listening. We conducted a statewide access to contraception survey that revealed a critical gap. At many campuses, students didn't know where to access reproductive care or even how to access reproductive care. This timeline shows our aggressive push to close that gap. By August 1st, we reached our first major milestone, ensuring that every public institution had a functioning access plan in place for the start of the academic year. We didn't just want a policy on paper, we wanted products on shelves by the first day of class. To ensure accountability, the law establishes a rigorous reporting cycle. For our community colleges, the requirements under statute are specific. They must provide an annual report to MHEC every September, detailing exactly how they are providing over-the-counter contraception and how they consulted with their students to design that access. Our four-year institutions are working under a broader mandate that includes 24-hour access to over-the-counter contraception and formal referral networks for clinical services. On October 1st, MHEC submitted our first consolidated executive summary to DLS, and this report serves as our roadmap, allowing us to see which campuses are succeeding and where more support is needed. We recognized early on that campuses couldn't do this in a vacuum. In June, MHEC hosted a full-day technical assistance convening at the University of Maryland, Baltimore campus. We had 59 registrants representing 42 different campuses. And in fact, this got such good word of mouth that we even had representatives from American University, the school in DC. We welcomed them with open arms. What was most striking was the diversity of roles. We saw nurse practitioners and health educators, makes sense, sitting alongside Title IX coordinators and vice presidents of student affairs. This whole campus approach is vital because launching a wellness vending machine or a new health center protocol requires buy-in from facilities, student government, and clinical staff. This convening allowed us to draft a statewide FAQ tool to standardize implementation across the state. As we look towards sustainability, our goal is equity of access. A student's ability to access emergency contraception should not depend on their zip code or whether they attend a community college versus a four-year institution. We are moving from temporary solutions to permanent infrastructure. This is why our partnership with the Maryland Commission for Women is so transformative. Through an innovative public-private partnership, they are now able to access $10,000 grants to community colleges specifically for the purpose of the installation of wellness vending machines. Schools like Howard Community College and Anne Arundel Community College are already using these grants to provide 24/7 discrete access to essential health products. This moves the finance burdens away from students and the institution, ensuring that these services remain a permanent fixture of Maryland's higher education landscape. In closing, our next steps focus on scaling these successes. While we may have made incredible strides, we are advocating for dedicated staff within MHEC to manage this as a permanent part of our student success portfolio. We are excited about Senate Bill 532 to refine the requirements further. Our mission remains clear. By removing health-related barriers from things like contraception, topic of today, to access to mental health and everything in between, we are ensuring that Maryland students can stay focused on their degrees and their future. Thank you, and I'm happy to answer questions.
Thank you. We're going to take Dr. Rodriguez first, and then I'll open it up.
Great, thank you.
I understand that you live across the street. Thank you. Thank you for doing that. Dr. Rodriguez, when you are ready.
Hello, I can't hear you in the room. Would you like me to begin my presentation? Okay. Well, I see heads nodding, so I'm going to go ahead unless somebody pops something in the chat to do otherwise. I'm Dr. Maria Rodriguez. I'm a professor of obstetrics and gynecology at Oregon Health and Science University, and a health services researcher that's been leading a lot of work on the over-the-counter pill. Appreciate the opportunity to share with you today some of what we've learned from our national cohort study on who the over-the-counter pill is reaching and benefiting. Next slide, please. So what we did was we conducted a national study. We recruited about 800 people who were getting contraception filled, either with the over-the-counter pill or by a prescription at a pharmacy, and we followed them for 1 year. Next slide. What we really wanted to understand is who is the pill reaching, who is it benefiting, and what difference does that make from the state's Medicaid perspective? And what we found was really exciting. We learned that the over the counter pill is really reaching people who have structural barriers to accessing care. So when we think about negative health impacts, we think about who's having a pregnancy they didn't want or plan. And we know that there's people such as those who lack insurance, younger people, adolescents or college students, people who live in areas remote from clinics that are having trouble getting in for care. And so what we saw was that people who were uninsured, teenagers, and women living in rural areas were all significantly more likely to be using the over-the-counter pill than via prescription. There was no difference between these groups in their desire to avoid pregnancy or differences in sexual activity. They were all at risk for becoming pregnant and did not want to be. And the over the counter pill provided a new way for them to help achieve their reproductive goals. Next slide. It was pretty significant, the difference we saw, in fact, because so many of the over the counter pill users, the same group of people who did not want to become pregnant, were using no method at baseline. So we saw that 31.4 percentage point increase in this group going from no method to using a very effective method, the over the counter pill. When we looked at people who were using a lot less effective methods, meaning a higher risk of pregnancy they didn't want over the next year, together, we found that 3/4 of the group of people purchasing the over the counter pill now had an effective way to prevent them from becoming pregnant. Next slide. We also wanted to understand how this was potentially reaching people with different or less traditional, perhaps, barriers to the healthcare system. So we thought about geography, we thought about age, we thought about cost barriers. We also wanted to understand how people's previous experiences with the health system, if they'd been negative in terms of feeling disempowered or discrimination, if this would also be more likely to reach them. So we used 3 different validated measures to help us understand what the past healthcare experiences of people using the over-the-counter pill had been. And these include the contraceptive agency scale, the person-centered contraceptive care measure, as well as a validated assessment of frequent discrimination in healthcare. Next slide. And what we found was that people who had lower senses of contraceptive agency or of not receiving person-centered care were a lot more likely to be using the over-the-counter pill. So while that's negative in terms of a lot of people reporting past negative experiences with the healthcare system, it is also reassuring that this is an accepted way for them to then get the care that they want. And it also provides us some insight into how we can be thinking about designing services. When we looked at people's experience with discrimination, we did not find a significant difference there in terms of use. Next slide. And importantly, when we're thinking about health policy and impacts, we looked at created a health economic model to understand how this might end up benefiting or impacting Medicaid costs. And that's in part because in Oregon and many other states, Medicaid does reimburse for over-the-counter contraceptive methods. And so what we found is no matter how we built the model or the stepwise assumptions we assumed, we ran extensive sensitivity analysis varying all inputs from 0 to 100. We found that for Medicaid to reimburse the over-the-counter pill was always what we call a dominant strategy. It both reduced costs and improved quality adjusted life years. We looked at whether it made a difference for states where abortion was available or not, and we found in both cases that it was a cost-saving strategy. Next slide. So from a Medicaid perspective, the pill packs would have to cost more than $250 a month for the state to not save money. They're currently retailing for about $20, so you can see the benefits there. There are some nuances in terms of how policy for coverage gets put into place. I think you're all well aware of that in terms of requiring a prescription versus not. What this model shows is that the fewer barriers we can have in place, the better in terms of health outcomes and reduced costs for Medicaid. Next slide. That's a whirlwind summary of the data we have so far. We'll soon be able to report out on how the over-the-counter pill is meeting the needs of people living in areas with a reduced contraceptive workforce. as well as abortion restrictions where we know the risks of maternal morbidity and mortality are higher, as well as reporting on what people understand or know about side effects and the safety of the medication. Next slide. Thank you very much. Since I can't hear you, I'll assume there's no questions, and I appreciate the opportunity to share this data with all of you. Thank you.
This is for, and this is for anybody, not just the Zoom speaker, Madam Vice Chair. So my question is that it's the best person to answer, of course. I was just wondering, thank you for all you do, but what are we doing to educate young men about the contraceptive resources available on campus? And I imagine that the reason I'm asking is because a sister might come to a brother because they're at the same school, or they might go to their boyfriend with in a panic. And so I'm just wondering how much work is being done to educate young men about the resources so that they can be supportive allies of women on campus.
I don't know. I don't know. I imagine that we do have campuses that are making explicit efforts to be inclusive of all students in terms of implementation. It's a question that I would be happy to make sure we include in the next round of reporting requirements for the campuses to respond to, so that this isn't a gendered initiative, that this is an initiative for all students to be aware of and have access to. So I think the short answer is I don't know, but it is something that I think some campuses are addressing, and we are happy to continue that conversation and elevate this issue.
That would be great. May I have a brief follow-up?
Yes.
I've also heard from women, this isn't exactly related to contraceptives, but I've also heard from women that the cost of menstrual pads is expensive and creates economic hardship for them. So are colleges also distributing free menstrual pads in addition to contraception, because they're both related to women's health?
Some are on their own accord, not all. And I am remiss that I am unable to remember the bill number, but there is a bill out this session that would require all colleges and universities, all public colleges and universities, to provide menstrual products in the bathrooms.
Thank you, Madam Chair.
Delegate Taveras.
Well, okay, so for Ms. Dr. Rodriguez, I would love to read the final report. Obviously, I just want to make sure that this is an econometric study where you're comparing prescription users out of the million, and that they are that there's a socioeconomic comparison of the groups, just making sure I'm understanding where we're comparing in terms of numbers. But is there so that's one, and then the breakdown on the savings, the cost savings that are seen within abortion protective settings versus abortion restrictive settings. Do we have a perspective where that comes from, like a rubric?
So, Delegate Taveras, unfortunately, we've lost our virtual witness. So
It's
I don't
okay.
know if either of you want to tackle that question?
I cannot, but we can make sure we get the question over to Dr. Rodriguez, and we can get that answer back to you, for sure.
Yeah, no, because my questions are technical.
Yep.
In nature. All right, thank you.
Yep, we can make sure we get her in touch with you.
Are there any other questions from the committee? Delegate Salega.
Thank you, Madam Chair. Whomever's best to answer this. How do you handle adverse side effects notification? Specifically, I know a couple of women who've had strokes from taking the birth control pill. If you're 24/7, how are you handling that?
Sure. So as I understand it, what is being supplied is the FDA-approved content. So it's the same product that you would buy at a CVS or any other drugstore. So those standard adverse warning signs would be part of the product that the student would have access to on campus. So it's the general public
The
adverse.
like 5-foot-long piece of paper?
Sure.
But again, so you don't give any actual, like, advice to contact a healthcare provider, or, I'm just concerned that women are not going to get the proper medical care and information about side effects, specifically strokes, because I know that is certainly not, it's not common, but it's not uncommon.
Sure. Yes, if that's okay. Thank you.
Yes. Hi, thank you. Yes, my name is Callie Cleland. I'm the Executive Director of the American Society for Emergency Contraception, and you'll be hearing from me in a little bit. I appreciate this question. I think it's really important to raise it so that we can clarify what is in these pills. So the over-the-counter contraceptive pills, O-pill is the only one we have on the market right now in the United States, doesn't contain estrogen. And I think some of the reports that we've heard in the literature of people having issues with stroke and blood clots is because of estrogen-containing contraceptive pills. And so with the pill that's available over the counter right now, there's no estrogen in it.
So there are no side effects? There's no medical concerns with that pill?
There are, the side effects are, nausea, maybe headache. They're transient and minor. And the FDA did a very deep dive into what the side effects might be. One of the requirements for FDA approval of an over-the-counter product is ensuring that the side effects are minimal and that an individual can understand the risks and benefits sufficiently, and that the risks are quite minimal.
So does the, I'm sorry, can I follow up one more? Thank you. Is there also information that women should seek medical, like, it's not like handing someone a Band-Aid is what I'm saying. They should seek medical advice and care if they need it?
On the label?
Yeah.
I don't believe, I think there's any standard language that would be on any over-the-counter drug label. There's no adverse event reporting required for O-pill or for any over-the-counter medication. So there's not a reporting mechanism that would be in place for this kind of medication.
Thank you.
So I'm going to follow up, I think, from the delegate's question, and I think this is probably for the MPEC folks. Is there encouragement for anyone who's taking advantage of this program to make sure that they are seeing the appropriate physicians and, doing well visits? Are they getting that encouragement, I guess, is what I'm asking.
Absolutely, and that's the value out of the plans that the campuses, because campuses could easily just put up the vending machines and say, check, we've done this. But the plans are supposed to talk about the holistic implementation so that students are getting access to those resources. They know who to go to. Particularly the community colleges that don't have direct health centers, they are working very closely with the local department, thank you.
Okay.
To make sure that there are resources, whether that be a nurse practitioner on the campus on a regular basis, to leverage local resources to benefit students. So yes, they're being encouraged to do a much more holistic approach, work with existing resources to do that so that there's not an extra burden, and to make sure students are aware of all the opportunities around reproductive health.
Okay, great. Thank you very much. Any other questions for this panel? Okay, thank you very much. So you're welcome to stay as long as you can before you have to leave. But I'll ask Executive Director Ariana Kelly to come to the table, and Dr. Cleland, just stay there.
Just a moment while we pull up the presentation. Perfect. And then to move them, do I just use arrows? Yeah. Perfect. Thank you so much. Hi, thank you so much for having me before you. For those of you who don't know me, which I hope is no one, I'm Ariana Kelly. I was thrilled to serve on this committee with you all for 12 years, and now I'm the Executive Director of the Maryland Commission for Women. And we are here today to explain to you a little bit more about what the work we've been doing with MHEC in partnership with ASEC. You just heard from Kelly Cleland. She'll be presenting after me, and we can answer any of your further questions about how this program is working. If I can figure out how to move the slides. Do the arrows not move the slides? Oh. Isn't that weird?
Yeah.
Sorry.
Technical difficulties.
Perfect. Okay. So for a little bit of history, and I loved that Delegate Shalego was the one asking these tough questions. I'm well accustomed to her hard questions on contraceptive and other healthcare issues. I want to make sure that those of you in this room know that Maryland has been a real leader on the issue of access to over-the-counter contraception. So back in 2016, and I know Delegate Shalego and Delegate Kipke were here then and both voted for this bill, Maryland was the first state in the nation to require insurance coverage for over-the-counter contraception. That was a piece of legislation sponsored by Senator Dolores Kelly, known as the Contraceptive Equity Act. In 2023 and 2024, we were the first state in the nation to require over-the-counter contraception access at both our 2- and 4-year colleges. That's what you just heard a presentation from MHEC on. That was Delegate Stephanie Smith, as well as Senators Kagan and Feldman. And Delegate Kelly was on both of those. We were also, this last year, thanks to this committee, or your predecessor committee, the first state to establish an implementation collaborative. That was through Speaker Pena-Melnick's legislation and Senator Hedelman's bill. So that's the collaborative you'll be hearing from in my second presentation in this briefing today. We're going to talk about another piece of legislation that you all passed last year. This September, we actually launched an innovative public-private funding partnership on over-the-counter access implementation, and that is in partnership with MHEC, but also ASEC, who is here today, the Strauss Foundation, and that's supported also by MDH, the Maryland Department of Health. Just want to draw your attention to our good friend, Senator Dolores Kelly, who was the innovative sponsor of the Contraceptive Equity Act. As many of you know, she is a longtime educator and a passionate advocate for women's health, health equity, and access to care, a longtime champion of the Maryland Commission for Women, and notably a 2026 inductee into the Maryland Women's Hall of Fame. So these are the Maryland roots to the access to contraception over the counter. Another really important Maryland root is Dr. Sharon Camp. Unfortunately, she passed away last year. She is a Hopkins-trained public health advocate and a businesswoman who actually brought Plan B, emergency contraception, to market in the US and Canada, also a longtime Marylander and a 2026 inductee into the Maryland Women's Hall of Fame. This picture is kind of explaining to you the partnership that we've entered into. And I really want to draw attention to the fact that MHEC went above and beyond here. As legislators, you all passed legislation requiring things of the schools that MHEC was to implement. They went above and beyond and really were innovative and proactive in seeking supportive partners that allowed this all to happen. So what you see on this graphic is that MHEC is partnering with the Commission for Women and ASEC with supporting funding from the Strauss Foundation to get the community colleges what they really need to implement that legislation that was passed. I'm going to come back to that because it's kind of a complex story, and I know that Kelly Cleland is going to really fill in the dots for you, so don't worry. I know it's confusing to follow all the different players. I want to step back for a second. You all have the annual report for the Maryland Commission for Women on your desks. I want to make sure you know what we can do, what we do, and what we can do as a state agency. So we were established in 1965 and became statutorily independent in 1971 thanks to the legislature. We have 25 commissioners, including 12 representatives from women's rights organizations across the state, as well as 13 individuals. They are appointed by the governor and confirmed by the Senate, so it's a partnership. We are housed and supported in the Department of Human Services. We are statutorily charged with informing both the executive branch and the legislative branch on a wide variety of women's issues. And we really enjoy working collaboratively across agencies to advance women's rights. So that's what you're seeing here. A little bit of history. We're in our 60th year this year at the Commission for Women, so I want to draw your attention to some of the agency partnerships we've had over the years. You're probably familiar with our partnership with the Women Legislators of Maryland to conduct the Maryland Women's Hall of Fame. We partner with the State Archives also and the Office of the First Lady to do the Maryland Women's Hall of Fame. In the past, we have partnered with the Attorney General to end sex-segregated job ads. We have partnered with the Department of Labor on workforce programs, and I'm hoping later this year you'll see legislation from the Speaker and Chair Bagnall that deals with menopause, and we're hoping to partner with the Department of Labor and Commerce on those issues as well in the future. We have partnered with Maryland State Department of Education, again, to implement Women's History Month in schools. We have partnered with the predecessor to DBM on family-friendly workplace policies. So this is the kind of work the Maryland Commission for Women is intended to do. For those of you who have had your legislation introduced at the Maryland Legislative Agenda for Women Conference, the MLAW conference, you should know that the Maryland Commission for Women actually founded MLAW and staffed it for the first 10 years before it became an independent nonprofit. Little bit more background on us, and there's a reason I'm telling you all this, because we are a small but mighty state agency with a paid staff of 4. You heard earlier our friends from MHEP pointing out that having staff to support the kind of work that we're doing is incredibly important. And I just want to really reiterate for you that we've been able to do what we can on this project because of a lot of grit and hustle. We have a small staff working on it. MHEC really went above and beyond. They were proactive. I take them seriously when they say they need dedicated staff to this, because what we saw on the MHEC side was nobody assigned to doing this, but it getting done anyway, which we love to see from a policy perspective, but I just want to note that they really need resources to continue with these kinds of programs. At the Commission for Women, we have 4 paid staff, and then we have a paid internship program that is supported by our affiliated foundation. Affiliated foundation, you might say. So let me tell you a little bit about the structure of the Commission for Women. We have a chair, again, appointed by the governor, confirmed by the Senate, Dr. LaShawn Stitt. She's an educator. Christine Lee, who is our second vice chair, is a pharmacist with expertise in health equity. And we have an affiliated foundation, the president of which is Sarah Klein. She is an attorney with specialization in consumer issues. So these are some of our 25 commissioners, and they've been leading on our over-the-counter access to contraception work. We also have a couple more commissioners. I don't have the slide, but I do want to mention, because again, these are leaders across Maryland who are volunteering their time to help us fulfill these projects. Gabriela Lemieux, who is the executive director of Latinos Unidos, is a commissioner who's on this OTC contraception project. Judy Carbone, you may know from the Mountain Maryland Alliance for Reproductive Freedom. She is on this project with us, as well as Takesha Everett, who is a public health expert from Prince George's County. So they're the commissioners that we've been turning to for guidance on this project. We do have an independent foundation. Our statute allows us to raise money to fulfill some of these projects. We established a 501c3 in 1996. The money we raised, which is private funding, exclusively supports the programs of the state commission. So if we came up with this idea at the state agency level, we can raise money for it on the foundation side, and all of that money will go to the programs that the state commission determined. That's all they can raise money for. And that's the story we're here to tell you today, is how, with partnership from MHEC and ASEC, we were able to solve a problem that all of you are familiar with, right? We passed legislation. The legislation seemed great. Someone mentioned somewhere along the line, is that an unfunded mandate? So we ran into that problem, and thankfully, because of this innovative, proactive problem solving, we found a solution, which is this over-the-counter campus birth control program. So this is a picture of the MHEP convening that Dr. Dow told you about earlier. It happened last June. At last June, all of those stakeholders who were charged with implementing the over-the-counter contraception access program came together. We heard amazing stories. MHEC, thankfully, not only included ASEC, who you'll hear from in a moment, but also included the Commission for Women. And we were able to talk with those community colleges and four-year schools who were implementing this work. And we heard from the community colleges over and over again, we'd love to do this, funding is a barrier. And that is where the innovation kind of came together. So and again, our partners from ASEC Kelly Cleland will tell you a little bit more about this later, but basically, I don't have that many connections with the deep pocket foundation funders, but ASEC does. They're a really important national organization, and they wanted to help us figure out how to solve this implementation problem in an innovative way. So we together worked on a grant, and it has allowed us to work closely with the community colleges to make sure they can implement the statute that was put in place in 2024. So I have a couple of success stories. Anne Arundel Community College they've received a grant from the Commission for Women through this project, and they're in the process of installing vending machines on 3 of their campuses right now. Howard Community College has also received a grant, and I want to note that these vending machines, again, to some of Delegate Shalego's points, they're not just, or actually to Delegate Kaufman's point even, these are public vending machines. And so they don't just include Opill or emergency contraception or condoms, which are obviously very important for men. So men are included in the use of these vending machines. But they may also include allergy medications, Tylenol, Narcan in some instances. I want to note that Montgomery College is also complying with the mandate, but in a different way, not through the vending machines. So we can talk about that. They're Montgomery County. Those of us who represented Montgomery County know they have their own way often. So they have an even more innovative approach that has same-day safe sex kit pickups. In summary, though, on the public-private funding partnership, I want you to know that for systems not like Montgomery County, the other systems that couldn't find the money to make this happen, we wanted to be there for them with this grant program. So in September, we got this grant. Again, thanks very much to the partnership with ASEC and from the Strauss Foundation. The grant went through our affiliated foundation, President Sarah Klein, and that money then is used to issue implementation grants to the community colleges once they submit an application to our foundation. ASEC has been a strong technical partner, making sure that those applications make sense from a technical perspective. They're the experts on how to do this best on campuses. We're not, right? We're a middle person entity. We're here because we know the community colleges, we know the stakeholders on the ground. They're providing the national level expertise, and MHEC is providing the support directly to the schools because that's their role. The grant program, which is still open, funds 11 pass-through grants to 2-year colleges for the implementation costs, up to $10,000 each. It lists right here on the slide what it can be used for, so I won't bother reading it to you, but I will tell you that the grant application is still open. We still have a couple of grants available, so if your community college isn't yet on the list, let us know, and we'll help them make sure it happens. Current grant awardees, again, you're capable of reading a slide, but I want you to know that in addition to this list, we are expecting to be funding College of Southern Maryland, Frederick Community College, and Warwick in the next couple months. That's our hope. And for next steps, and I think this is important because I know when Dr. Dow was speaking, she mentioned pending legislation this year. There is Senate Bill 532, which is Delegate Smith's legislation, also Senator Kagan and Senator Feldman. It's really a cleanup bill. It's meant to streamline and clarify the requirements for this program. It does 2 things. It requires that the 4-year universities submit their reports to MHEC. Right now, only the 2-year schools are required to submit those reports. The 4-year schools have been voluntarily submitting the reports, but this clarifies that requirement. And then it also really makes the language clear. And again, this is aligning the two statutes. The four-year school, the language was very explicit that we were talking about all forms of FDA-approved over-the-counter contraception. This is just taking that same language from the four-year statute and putting it in the two-year statute, so there's no confusion about what the legislative intent was. So it really is truly a cleanup bill, and that is going to be happening this year. Also, to Delegate Kaufman's earlier question, House Bill 457 is Delegate Feldmark's legislation related to menstrual products. As a commission, at the Commission for Women level, we're going to continue to do research on how to best attain retail counter coverage for over-the-counter contraception, which we know will improve access. We're also going to be staffing the over-the-counter collaborative and making sure you all get that final report, which is due in December, engaging with all the communities involved in that work. We are likely to be doing a condom wrapper design contest, engaging the 17 local commissions for women in this work on the ground in partnership, engaging student leaders, and again, to Delegate Kaufman's question, we engage all genders in this work because it impacts all genders. We will be working on a webinar to engage the campus administrators to make sure they have the support that they need, and any changes that they need to comply with if this legislation we just talked about passes, we'll be supporting them with that as well. So that is my presentation, and before I answer any questions, I will hand it over to Kelly Cleland.
Thank you so much, and thank you all for the opportunity to be here today. I am so excited. I took a really lovely ride down this morning on Amtrak to be here with you today. So my name is Kelly Cleland. I'm the Executive Director of the American Society for Emergency Contraception, or ASEC. We work nationally to improve access to emergency contraception wherever people are. So we want to make sure people can get it without barriers, without stigma, and at an affordable price. When we think about the national landscape for reproductive rights, there are a lot of challenges that people are facing, and these are challenges faced by individuals, by lawmakers, by community organizations, by campus groups. And I think, as an organization, when we consider what the challenges are, our goal is to work with local organizations, state legislatures, anybody who's interested in making sure that we can improve access in a way that is locally appropriate and tailored to the needs of the situation that we're in. There are some really exciting opportunities on the landscape, on the horizon, including I think there's a growing recognition that emergency contraception and over-the-counter birth control pills are really important for reproductive autonomy. This means that people can get what they need when they need it to decide when and if they become a parent. There's a lot of evidence, as Dr. Rodriguez told us about the importance of these pills and the role that they play in reproductive autonomy. Lots of youth organizing. We're so excited about the work we're doing on campuses with young leaders. And interest from philanthropy in moving these models forward. And of course, state advocacy. And I have to say, I wish every state was Maryland. If that were the case, then maybe we could close up shop and I can retire and be done. Maryland is really a tremendous place to work. And I'm gonna talk a little bit more in detail about what we're doing specifically in Maryland. But first, I just want to take a step back and talk about emergency contraception and why it's so time-sensitive and urgent. So the first thing is about the way that these pills work. Emergency contraceptive pills work by preventing or delaying ovulation. So if there's no egg, no pregnancy is possible. If you miss the window to prevent or delay ovulation, that means that pregnancy can occur. And so any barriers that we see to people getting emergency contraceptive pills can increase the risk of pregnancy. Pregnancy prevention is more urgent than it's ever been, and that's in large part because of restrictions that we see across the country on reproductive rights. And individuals who experience sexual assault need to be able to get emergency contraceptive pills immediately without any barriers. And finally, we know that as with many parts of healthcare in our very broken healthcare system in the United States, barriers to accessing EC disproportionately impact populations that are already vulnerable. As an organization, these are the 3 pillars of how we work. Research is a very big part of what we do. It's important to make sure that everything that we put out is evidence-based. And so we produce our own research to understand particularly issues around access. We also analyze the existing clinical research to create clinical guidance about emergency contraception for healthcare providers. We do advocacy, working with state legislators, any kinds of organizing groups that want to improve the landscape. We've got a lot of things, we've learned a lot of things working in different parts of the country about what works here, what hasn't worked as well, and we can keep refining and tailoring those strategies. And we provide direct support to individuals and organizations and campus groups that are trying to improve access to emergency contraception in innovative ways. Emergency Contraception for Every Campus is our campus organizing program. We launched this in February 2020, and it turns out that that was not a good time to launch a campus activism project. But we have still, nonetheless, we have accomplished a lot of really exciting things. And I want to share a little bit about how we work with campuses on the national level. We provide, as I mentioned before, everything we do is evidence-based. So we provide evidence-based trainings and toolkits that people can customize to the environment that they're in. We offer technical assistance. We do one-on-ones or group sessions with staff and administrators who are trying to figure out some of the nuts and bolts. Where do you buy a vending machine? How long does it take to get this stocked and get running? We offer tailored approaches that can really work in any policy environment and on any kind of campus. And we connect individuals and organizations to suppliers that we have vetted and that we trust. We don't have any kinds of financial relationships with any companies, but if we talk with a company and we believe that they're mission aligned, we'll put them on our list. And we do direct advocacy support for student leaders, and that's a very important part of the work that we do to build the leadership of young people. And I just want to shout out our organizing program in the South. These are our fellows who we just onboarded last month. They are doing this work in Louisiana, Alabama, Georgia, and Florida. So when I say I wish every state was Maryland, I'm sure these young people do as well, but they're doing incredible things. And I mentioned earlier, we started this program in 2020. At the time, there were 17 campuses across the country that offered a vending machine that included emergency contraception and other health supplies. And these are across 9 states. And now there are nearly 150, and they are in 30 states. So we are extremely excited about the momentum that this movement has gained. We have worked really hard to sort of normalize the idea of health and wellness vending machines, and we see this growing and growing. And if you take a look at this slide, you'll see that there are concentrations of these vending machines in some states. And the reason for that is policy. So these are states that currently have policies in place that either require or facilitate access to emergency contraception on college campuses. So typically these relate to public campuses and are often specific to emergency contraception because many of these laws were written before OPIL was approved for over-the-counter sale. Some of these states have policies that include funding, which is always really nice for campuses, and some of them just lay out guidelines for how this needs to be done. We are hoping that more and more states are going to be inspired by places like Maryland and introduce similar legislation. We really see Maryland as setting a standard for reproductive freedom in the United States, and we are so excited to see MHEC and the legislature really putting the well-being of students at the forefront. Maryland follows evidence-based best practice by ensuring that equitable access to over-the-counter contraception is available. And I want to highlight two things that I think are really important about Maryland's legislation that governs OTC access on campuses. One is that it includes all OTC contraceptives, so that includes OPIL. And as I mentioned, some of the other laws in other states were written before OPIL was approved. But I think having OPIL available, OTC and on campus, is powerful. And Dr. Rodriguez told us some examples of exactly why that is the case. I also really appreciate that in Maryland, there is separate legislation that addresses the needs of four-year colleges and two-year colleges, because the needs and resources available are extremely different. The student populations are very different. So it's important to recognize what differences and strengths and challenges exist in both types of settings. These are some quotes from our grantees. You have these in your packet, but I just want to note how enthusiastic people are about being able to receive support and funding from the Strauss Foundation, and support from the Commission and from MHEC. So we're thinking about what's next. We are very, very excited about building out the next stage of work based on what is happening here in Maryland. We've gotten a lot done altogether. There's more to do. And so we know that refining these models and continually improving how these models are implemented on campus requires resources. MHEC has been an incredible partner to all of us in this work. I think the only way that MHEC could do it better is if they had more resources. And I strongly support MHEC being able to hire a person to really focus on these issues. We are very interested in bringing forth this model that Maryland is championing so that other states can learn from what is happening here. The implementation that's happening here of the legislation that you all have passed will contribute to the evidence base that shows this connection between student retention and success and availability of over-the-counter contraceptives. We are doing focus groups in March with students on community college and four-year campuses here in Maryland to help refine our understanding of what's working and what is not working as well. And we're producing a best practices document based on our experiences here in Maryland in collaboration with our partners to make sure that, that everybody can learn from the lessons here. And we want to scale this bigger, because I think there's a lot that other states have to learn from what is happening here in Maryland. We're developing a blueprint for OTC contraception access with a focus on emergency contraception so that states in any policy environment, in any geographical location, can find a way to make access to OTC contraception a reality for the people they serve. And you're hearing this early. This is not publicly announced yet, but we have a new grant program that is very much based on the grant program that we have running here in Maryland. One of ASEC's individual donors has very generously agreed to fund a program to support 17 community college campuses around the country to have, to stand up a vending machine on their campus. That will include emergency contraception, OPIL, and whatever other health products their students need. And in closing, I just, again, want to thank you all for letting us be here today and listening. I want to really thank the Strauss Foundation. The Strauss Foundation concentrates a lot of their work in the Baltimore community. They're a tremendous partner. They believe in the power of community to make change happen. The Strauss Foundation approached us in 2023 because they were so excited about the legislative changes here in Maryland, and they wanted to see how they could be part of helping implementation really work. We have been working closely with public policy partners and Robin Elliott for years and years, and Robin has been instrumental in providing insights to us about the Maryland landscape, how things work here, and she introduced us to Ariana Kelly, to the folks at MHEC, to the folks at MDH, and has just really been an incredible thought partner throughout this work. And of course, these state agencies have been just really incredible. MHEC, the Commission for Women, MDH. We've been so thrilled to see the true collaboration that is happening here. I think it's rare. I think you all are really lucky here in Maryland. So thanks to you all for your time and for your support of this work, and we would love to take your questions.
Thank you very much. And yes, I think that we are grateful we live in Maryland. So are there questions? I see Delegate Taveras.
Thank you, Madam Chair, and thank you for your presentation. I wasn't able to get this set of slides, but if somebody could send it to my office, I'd appreciate it. But the question that I have, I see that there is much emphasis on colleges and universities and community colleges, and it's very real. And thank you for that, and I think the data shows. However, I'd like to see if there's possibilities for us to also include high school students in this conversation, since 2/3 of every child that's pregnant drops out, at least in my district. And I'm seeing comparable high percentages pregnancy rates throughout the state.
So Delegate Taveras, I appreciate your question tremendously. Let me just point out that once we're done with this, I have one more presentation, which is on the Over-the-Counter Access Collaborative, which will get at the general population, not just the campus populations.
Thank you.
Delegate Kaufman.
Yes, this is for the Ms. Cleveland from ASEC. I wanted to know, and I totally, support everything you're doing, so don't take this question the wrong way. But do you work with people across the ideological spectrum to try and bridge differences and see where you can find common ground? Because listening to the presentation, I really enjoyed it and think that your work is terrific, but I can see it giving other people on the more conservative side of the spectrum some pause. So do you try to bridge ideological differences, I guess is my question.
Yeah, thank you for that question. I think it's incredibly important to make sure that we can work together with people across the spectrum, as you say. I think one of the things that we really try to do is make sure people are educated about what emergency contraception is, that it's not the same as medication abortion, although abortion is an incredibly important part of the reproductive health care continuum. And we talk, particularly when we talk with medical directors on campuses and some of the administrators, we hear a lot of concerns about young people accessing these products. And so, yes, we absolutely work with folks to help them understand why it's important and why it's safe for young people to have access. I appreciate that question.
Thank you so much. So I was at my alma mater, TU, Towson University, saw a vending machine, took a picture of it. So, I just have just a couple brief questions. Yes, indeed, there are Band-Aids in there. There are highlighters, pens, Afrin, all kinds of stuff in there. And then, feminine hygiene products. And then, of course, the O-pill that you talked about, which is $40. So I wonder, do you also, as former Delegate Kelly mentioned, we did pass a bill to give access to over-the-counter birth control on people's health insurance. It's much less than $40. Do you also provide information, I didn't see it on this machine, to encourage women to go get gynecological care, to visit their primary care provider?
So the machines are all installed by the universities themselves. We don't actually install them. We do encourage everybody to have QR codes that give information about sexual assault resources, because a lot of the time people who are seeking emergency contraception have experienced sexual assault, and resources for ongoing contraception. I absolutely agree with you. If a student has insurance, they're going to have they're going to find a lot more affordable options if they go to a primary care provider, or hopefully to the student health center, to use their insurance to get contraception.
Yeah, and follow up with what Delegate Kaufman said. In the same vein, I didn't see any opportunity, and I hope you would entertain it and actually provide an option for women who choose pregnancy. I mean, if you're pro-choice and you want people to have a choice and they choose to have a baby, wouldn't it be helpful for them to have a resource at this vending machine for go visit your primary care? Here's where the health center is. If you're pregnant, here are some resources for you as well.
Sure, yeah. I assume that, that resources that colleges provide about health services would include students who are pregnant and parenting. Our baseline assumption is that students who are going to a vending machine to buy emergency contraception or O-pill are not yet pregnant. Emergency contraception prevents pregnancy. It doesn't work if someone is already pregnant, and so therefore we're assuming that we're not speaking in general to a population of students that's already pregnant. But I appreciate the question. I think that it is incredibly important for colleges to be able to provide care and support for those students as well.
And your opportunity to do it as well, right there at your vending machine. Thank you.
Yeah.
Thank you. Delegate Rosenberg.
So, and the healthcare facilities on campus or nearby offer the services for whatever is the choice of the woman involved.
Yes, Delegate Rosenberg, and in fact, this speaks to the legislation we mentioned that is being introduced this year, which is, I want to say, Senate Bill 532, House Bill 1076. So the four-year colleges haven't yet all submitted their reproductive health services plans to MHEC, so we want to make sure that there's transparency around what those plans are. But my understanding, based on speaking to those schools, is that yes, they're all offering these wraparound services. That's the expectation in the requirement the legislature passed.
Thank you. Thank you, ma'am.
Okay. Seeing no further questions, that concludes this panel. And thank you very much, Ms. Cleland, for being here.
Of course, thank you all.
And Director Kelly, you're
So
going to
close.
wrap us up?
So close, almost done, I promise. And this is going to get to a lot of the questions that Delegate Szeliga was very appropriately raising, as well as Delegate Tavares. So I will start talking while we get the slides loaded up. If you all recall, we passed you all, I am no longer a member of your esteemed body, but you all, in your wisdom, passed legislation sponsored by Speaker Pena-Melnick last year, Senator Hettleman in the Senate, to charge the Maryland Commission for Women with figuring out how our over-the-counter birth control coverage statute was working on the ground. So how do we make sure that people know they have coverage? How do we make sure that people can access that coverage so that they're not paying, $40 out of a vending machine if they have insurance coverage for the same product? Again, that was House Bill 939. It is a stakeholder group made up of 20 stakeholders. We have 5 representatives from the relevant state agencies: MIA, MDH, both Medicaid and Public Health, DBM, the Health Benefits Exchange. We also have national experts like Kelly Cleland, who you just heard from. We have 5 national experts and 10 state stakeholders representing the impacted industries, professions, and communities. This collaborative only first, started meeting this fall. Of course, you know how long it takes to get these things set up, but we did publish an interim report that is on your desks. I don't have it with me, but you all have it. And it has met 3 times, and there are another 5 meetings scheduled. Thank you very much. That is Brett Jordan. She staffs our over-the-counter collaborative. She is a goddess. We are thankful to her. So the interim report was submitted to the legislature in December, and the final report will be coming this coming December. So there's a lot of work still to do. We have some friends who have volunteered to chair this collaborative. So you may know Dr. Cynthia Bauer, who's the director of the Horowitz Center for Health Literacy at the University of Maryland School of Public Health. She is co-chair, along with a good friend to this committee, Aaliyah Horton, who is the executive director of the Maryland Pharmacists Association. So very, very much gratitude goes to these 2 individuals who've been chairing this collaborative and gotten it off to a quick and productive start. I have a list of the collaborative members in my presentation. It's also available in the report. Just wanted you all to know that the state agencies, again, have been very proactive, actively participating. We're so thankful for that, as well as the the stakeholders that this committee identified as important to this conversation. Specific responsibilities for the collaborative were to advance access to over-the-counter birth control through implementing state coverage requirements for over-the-counter birth control at pharmacies, advancing point-of-sale coverage, to Delegate Shalego's point, options at retail counters, virtual platforms, and vending machines. And also, I think to some of the points that Delegate Taveras was getting at, identifying public health initiatives that could increase over-the-counter birth control access, and enhancing education and engagement of consumers, healthcare practitioners, et cetera. So those are the responsibilities you charged us with. Again, after only the first couple of meetings and the interim report, you will see there were 2 recommendations. The first was that the relevant state agencies should issue consistent billing guidance for all insurers and PBMs regulated by the state. So that was a recommendation in this report. That's going to help prevent confusion at pharmacies about how to do the billing and improve access. The second recommendation, bigger picture idea, was to utilize new and existing public-private partnerships to raise awareness of coverage options for over-the-counter contraceptive drugs. So again, these are recommendations. We're working the whole next year on more recommendations and also beginning to execute those recommendations to the best of our ability and with the stakeholders around the table. So again, in the coming year, we are required by statute to analyze the comments on the federal rulemaking on this issue, to assess the feasibility of retail coverage strategies, to develop best practices for public education, to consider innovative strategies to bring low or no cost over-the-counter contraceptive access to those who don't have insurance coverage, and to provide technical support around the development of billing guidance as needed based on the first recommendation. So our final report will come to you next year, and it's going to contain the recommendations on these issues. You already saw Brett Jordan, who I hope will join me, because when you have hard questions, she can answer them. Thank you. And also want to highlight that Taryn Graves is our graduate student who is a research consultant on this project as well. At the Commission for Women, we involve students in all of the work that we do. In my last presentation, I neglected to mention Alex Mayan Rodriguez, who is a student at Howard Community College, who is one of the students working with us on campus access, and Hannah Breslau, who is a student at University of Maryland in their public policy program, who has been working with us on access in the 4-year schools. Taryn Grave is working with us on the OTC collaborative work. So that is a brief presentation on the very large report that you have in front of you that has the minutes from all of our meetings, mentioning, of course, the first 2 recommendations and committing to you all that we're going to dig through the rest of this work over the next year and make sure to come back to you next year with a thorough report full of all the recommendations you have asked for, and also just really thanking the state agencies and the volunteers who have given their time to the work of this collaborative, as well as introducing you to Brett Jordan, who is managing the collaborative for us. Thank you so much.
Thank you very much, and my apologies. I've had an event with our federal partners in district, but I know that our amazing vice chair has been doing yeoman's work. Do we have questions from the members? Vice Chair Cullison.
Thank you, Madam Chair. I don't actually have a question, but I want to say how remarkable it is for you to have this collaborative across agencies, across organizations, and it really demonstrates how effective we can be when we build those partnerships. And I think that, I think as Ms. Cleland said, we can model this, not just across the nation, but within Maryland, because there are other opportunities for these kinds of collaboratives in other areas. So thank you for providing that example and model, and I appreciate all the work that everyone's doing on this, so thank you.
Thank you, and I will echo the comments of our amazing vice chair, and also take a point of privilege to say how exciting it is to see you back in our committee in this role and from this seat. So thank you very much. I think this concludes our briefing for today, and let us know when we're down.